Well, it is an art form to be able to write about these complex topics and make it understandable for everybody, which you're terrifically good at. So keep writing. And speaking of that, what's the next book, Marty?
I'm really interested in the microbiome and how it relates to health. You know, so much of health is really inflammation, comes down to inflammation. And when we talk about health in 100 years, Gary, I think we're going to be talking about what's your level of inflammation. And it's measurable to some degree. We've got some crude tests now, like highly selective C-reactive protein. But inflammation is why people die of heart attacks. The blood vessel wall gets inflamed, and that's when the cholesterol moves in and the lipids move in. It's implicated in cancer. It's why we have a whole host of diseases we never had before: ulcerative colitis, Crohn's, irritable bowel. These are common. They didn't exist before 1920. Why is that? Maybe the advent of antibiotics, which screws up your microbiome. Now, antibiotics save lives. I've seen that, but when not indicated, and studies show even from the CDC that up to 70% are not indicated, it screws up your microbiome. Processed food, added sugar, bottle feeding instead of breastfeeding when somebody can breastfeed, even C-section versus vaginal delivery, and not washing a baby immediately upon delivery. All these things influence the microbiome. We don't talk about it. The science just hasn't caught up. I think it's the big frontier in healthcare. And as somebody who has a background in gastrointestinal medicine and GI surgery, it's been something that's always fascinated me. So I think it's the future, and it relates to food as medicine, which is also something I'm passionate about.